Radhe Radhe to all, and I hope everybody is doing perfectly fine. So today we'll be discussing a very small topic but very important topic. हम कॉमन टर्म्स में भी हम देखते हैं गॉल ब्लैडर, पथरी की दिक्कत। तो ये एक बहुत ही आम बात है जो लोग आपस में जो लोगों में होती है और लोग जानते हैं इस बारे में, and they tend to discuss also. So gallbladder stone, so gallbladder pathology is very common. It's like a, you can say every other surgery, if you can say, it's like a gallbladder surgery which the people are undergoing, the patient is undergoing. So there are many numerous causes because of any kind of cholecystitis. Maybe it is because of your chronic irritation, because of your stone, or any underlying cause. So that leads to gallbladder pathology. So one important pathology what we'll be discussing today is cholesterolosis. So this is as the name suggests, there is something to do with cholesterol in gallbladder. Fine. So let's move ahead. So first, I'll just describe you in brief that where this gallbladder organ is located. So this is what? This is a normal human anatomy of a liver. Here you can see the portion of stomach. It is there. This yellow thing is your pancreas, which is head of the pancreas is lying in the duodenum, that loop of the intestine. And then this is the tail of the pancreas. Now coming to the organ which we are discussing today. So this is the green one you can see in the back. So the normal location of gallbladder is beneath your liver, and it lies in a proper depression in the back of your liver. That is known as your gallbladder fossa. So typically it lies there. So what are the function? Why it is important? So normally when you describe the anatomy, see whenever we read pathology, we should know the basic structure, how the organ looks like. So you should have an you can imagine the pictorial representation of that organ, how per se it is. So it's basically a small organ, pear shaped organ. So that is, and what is the primary dimension, you can say in adult it is usually 7 to 10 centimeter long. And what is the important function of gallbladder? It store and concentrate your bile, and normally when it is distended it can hold up to 50 ml of your bile. So this is the normal thing which I wanted to discuss. And let's see, here only I'll tell you, when you see read the histology, so gallbladder आपको normal gallbladder कैसा दिखता है? Suppose I am making a layer. So this is the mucosal fold of gallbladder, and here you will see single line columnar epithelium which is lining the mucosa. Fine. So this is one lined epithelium. So one lined epithelium है. इस ये आपका lamina हो जाता है. Then you have your muscle. So you have a smooth muscle bundle here. So this is like this. So this is muscle bundle, muscularis layer. So below muscularis layer you have your subserosa. तो इस लेयर में ये बहुत ही लूज इडिमाटस लेयर होता है. इस लेयर में you will get your veins, you will get your arteries, and you can get your sheets of adipocyte, the fat layer. Fine. And last is the lining, that is the serosal lining. So serosa is there. So ये आपके mucosal fold है. यही अगर आप लंबे लंबे folds में आते हैं, we say that there is a Rokitansky Ashoff sinus which is very particular for your gallbladder. So that is a normal histological picture you should keep in mind. Then I'll tell you what is the pathology in cholesterolosis. So here we come. So what it is basically है क्या ये? So one important term, that is cholesterol esters. So they are getting deposited in wall of gallbladder. Fine. Why it occurs? So the definitive etiology is not known, but they say that as the age progresses, so it is basically aging process which is leading to deposition of these cholesterol esters in the wall of the gallbladder, or it can be because of increased amount of saturated fat in your bile. And earlier we used to think that obesity, diabetes mellitus, all those the old factors were there in causing this kind, but the exact role is not defined yet. But definitely those are sedentary lifestyle diseases, so can be correlated with your increase in cholesterol esters in bile. So sign and symptom. How patient will present to you? Main is your abdominal pain. Then patient can have indigestion. Patient can also present to you with fever and jaundice. So you can keep all these three things and four things in your mind. Then diagnosis. How it is made? So diagnosis basically depend on your radiology imaging. Clinical feature, obviously it is very important. The location of the organ, that quadrant is giving you pain, giving pain to the patients, that you have to keep in mind. Then radiology, CT scan, MRI, it's not, CT scan is more than enough, ultrasound CT. Then coming to the role of histopath. So once that surgically that has been excised, so what we get, so we get to know all those layers, fine. Now I'll show you the picture here. This is the gross anatomy of the specimen. This case I am discussing, I got into reporting in my lab. So here you can see this is a normal gallbladder. I said you this is a small organ, pear shaped organ here, green because of your bile content, fine. And this is 7 to 10 centimeter long, and when we get a cut surface, though not appreciable, here what we got is a thin white streaks in the wall of the gallbladder. That I'll show you on histology how it looks like. So I told you the layers of the gallbladder. So here you see. So these all are your mucosal folds, right? Which are thrown. Then here this is your muscle layer. You can see there is increase in muscle layer. Then we have subserosa. Subserosa has your blood vessels. They can have artery, can adipose tissue can be there. Then you have your final serosal layer. Just the similar picture. These all are your mucosal folds, and this area which I am pointing round, round. I'll show you in a high image also. These are having your cholesterol esters. So this is your muscle layer. This is your subserosal layer which has a vessel, and then you have your final serosa. So the high power of this. So this picture I have shown you because of this. See, muscle bundles are increasing. It's coming to the lamina. So these are your mucosal folds, fine. And this is lined by your thin the diagram I had drawn, single tall columnar epithelium. And this lamina is started with your cholesterol esters. So this whitish cells जो है ना बड़े बड़े से cell macrophage जैसे हैं, these all are your cholesterol deposits which are getting deposited in the, this is beautiful picture. Here you can see a single line mucosa which is lined by a single layer of tall columnar epithelial cells, and in between the lamina you are seeing the studded cholesterol esters. So this is the same high power of the same. यहाँ पे देखो आप single layer है mucosa lining is your tall columnar epithelium, and inside you have your cholesterol esters. So this is cholesterolosis. So it's a benign condition, nothing to worry. Just in case the patient is getting symptom because of some inflammation, cholecystitis, the gallbladder is removed. So cholecystectomy is the term which has been given to removal of gallbladder. So thank you so much for your patient hearing. Kindly like, subscribe and share my YouTube channel Patho with MK. Have a great day.